So in the practice, you do the orthodontics and your husband does everything else?
That's correct, Randy.
So
Yes.
with kids, when should they get something done? Talking to parents for a moment.
So it's important to have your children evaluated for orthodontics as soon as possible, around 6, 7 years of age, especially in young individuals who have underbites, overbites, constricted palates, large spaces in between their teeth, or no spaces in between their teeth. These are all signs of problems to come.
Do you have to wait until they get the permanent teeth?
No, not at all. No, as long as you have a few of the permanent teeth, then we can go forward with phase 1 orthodontics.
What's the advantage to getting it done early as opposed to waiting until you get the permanent teeth?
Well, you can correct a lot of problems early on and prevent jaw surgeries later on, like around the age of 18, 19, 20 or so. So jaw surgery is a huge thing that could happen if these problems are not corrected early on.
So what is the typical age that the parents are bringing them in?
Usually around the age of 11 or 12, and most of the children now have their permanent teeth, so we can go forward from that point. Yes.
Anything new, by the way, in ortho?
There are new things all the time, and one thing that looks very promising is accelerated orthodontics. Be it a surgical method, which I do not use in our practice, but there is a device by the name of Excelident, which can cut down your time in braces by 40 to 50%. And I have been using it on some of my patients, especially those adult patients who want to get out of braces fast, and it's most promising. And it also helps minimize the discomfort or the tenderness that might sometimes be associated with the tightening of the wires, etc. So it looks very promising.
Now for the kids,
Yes.
Do a lot of parents wait too long? That means that they wait until the kids are too old,
Yes.
like 16 or
Yes.
17?
The common misconception is that we have to have our permanent teeth to be able to do orthodontics, but that's not necessarily the case. We can start as early as 6 or 7, and that's when I really would recommend getting evaluated.
So if you noticeably see crooked teeth on your
Yes.
child, get in there soon.
Yes.
Because then the permanent ones come in what, straighter?
Well, if we can intervene orthodontically, absolutely, and we can prevent extraction or removal of teeth, and possibly with the underbites or the overbites, we can prevent jaw surgery, which is crucial, which is a huge thing.
How important are smiles, in your opinion, to young people
Oh,
going
they're-
into high school?
Oh, they're very, very important. When you look at yourself and you see what you like, that's when the inner smile comes out. It helps increase your confidence, your sense of self-worth. It has an impact on your psyche, on everything. It's huge. It's huge.